Atypical hemolytic uremic syndrome, or AHUS, is a life-threatening but very rare disease, and it commonly causes kidney failure requiring dialysis treatment. And it's a difficult disease to treat in the longer term because the outcomes with kidney transplantation are not very good either. From the time of diagnosis, approximately 1 in 10 patients will die within that first year. We also know that for the patients who survive the initial episode and end up on dialysis, that their mortality will be approximately 15% per year, which means over the course of around 4 years, over a third of those patients will no longer be alive. And that's worse than many forms of cancer these days.
I went in for a routine gallbladder operation, and when I came out I just didn't get any better. I was having severe headaches, felt really sick, and I was sent to the emergency department that afternoon and ended up in the ICU with renal failure, and it just all cascaded from there.
We didn't know what was happening. I was in and out of comas, I was in and out of hospital. I was flown from Rockhampton to Brisbane and placed in ICU on a dialysis machine, not knowing what was wrong with me.
So AHUS is difficult to diagnose because, like many very rare diseases, a lot of doctors just don't have any experience with the disease, and it can be diagnosed as something else initially, or there can be confusion about which tests should be ordered. So unfortunately it's very rare for patients to present with AHUS with mild symptoms early on in the course of the disease.
I just started to have like normal flu symptoms, like a cold. I had very puffy eyes at one point and puffy lips. Then I started vomiting up everything.
In terms of symptoms for AHUS, it's very difficult because most patients are younger and present with a very late stage of the disease, that is usually with kidney failure. So by the time they come to medical attention, they've already got kidneys that are not working at all, they're very ill, and they require dialysis treatment almost straight away.
I know when Ashley first got diagnosed, he was on dialysis, but they hoped that he'd come off it, and then when they started talking about me learning how to do the dialysis at home, and I think it took them a few days for me to actually watch them do it and start learning, because I didn't want to know about it. I didn't want to believe that this was going to be part of our life.
AHUS is a disease that can affect almost anyone, and we know that in a lot of patients it's due to a mutation that sometimes runs through families, but we don't always see a family history. So sometimes patients can be the first member of the family to be diagnosed, and it's only later when another member of the family gets diagnosed with the same condition that we can see that it's clearly a disease that runs in that family.
She was born perfect, so at 7 months old, when I learnt that she now has a genetic disease that is fatal and that cannot be treated in any possible way, I was very devastated.
So the things that cause a flare of the disease, such as pregnancy, for example, was one of the common ones, means that not infrequently it's young women that are affected by the disease.
6 weeks after giving birth to my little boy, who was premature, I didn't recover. I saw several doctors, knowing that something was wrong and no one would diagnose anything. Finally, I demanded a blood test, and that was the start of my horrible journey.
The outcome of the IVF was no children for me, because it steamrolled into this AHUS. My kidneys were failing, my liver was failing, spent a week in a coma. They were telling my family to prepare for the worst.
In the first year of diagnosis, he had 10 trips to theatre, dialysis tubes inserted, and he was just malnourished, and test after test and complication after complication. And then, when he started plasma exchange, he was so little that they had to use donated blood to prime the lines of the machines, because otherwise the machines would have taken all of the blood out of his body.
As well as commonly developing kidney failure that requires dialysis treatment, they also get very significant other complications, and they can include heart attacks, strokes, symptoms related to their gastrointestinal tracts.
Well, constantly it's just a feeling of unwellness. My blood pressure is very high. I'm tired all the time. I feel very nauseous and I vomit up a lot. So my nutrition isn't that good anymore.
These symptoms can come and go over time. So they may be well for a period of time and then suddenly have a stroke, or suddenly have a heart attack, and this can happen perhaps once every few years in some patients with the disease. So current treatments for AHUS unfortunately are only supportive treatments, so they include dialysis for patients whose kidneys have already failed, and also plasma exchange, which is a process where we replace the patient's plasma, the liquid part of the blood, with artificial plasma. And that can help to switch off a crisis that can cause kidney failure or a heart attack or a stroke, but it doesn't treat the underlying problem which causes AHUS. Soliris is the only treatment for AHUS which has been shown to be able to switch the disease off, if you like, and it's the only treatment shown to actually prevent patients from dying from AHUS. The Life-Saving Drug Program has been set up in Australia specifically to fund expensive treatments for very rare diseases, and this is so that patients who are unlucky enough to have rare diseases have an equal opportunity to access funding for their vital treatment. It's very important that the Soliris treatment is funded by the government because it's too expensive for patients to have to pay for themselves. And with rare diseases like AHUS, it's not the patient's fault that they've got the disease, they're just unlucky that they have a disease for which there's a very expensive treatment.
How it makes me feel to know that I have Soliris in this country, that Soliris is available for PNH, that Soliris is on the Life Savings Drugs Program for something else and not for something that's called AHUS, is beyond angry. I don't even want to use the words. I am ashamed. My child is dying. Her kidneys are failing every single minute I'm talking to you right now.
The prognosis for me, as far as I'm aware, without Soliris is the next 40 years or however long I'm alive, doing dialysis every second night for the rest of my life. It means the illness can come back and attack me at any time. I've lost my kidney function. I have no function at all. I already have heart issues. And the chances of other things going wrong with other organs is greatly enhanced.
What price is a life? Please approve the drug for use for AHUS.
Nobody wants to think about losing their little boy. It would, couldn't even imagine, couldn't even try and describe what it would be like.
This disease doesn't have a long time frame. It's a killer.